Concussion awareness. Module 3. Responding to head injuries. If a child sustains a blow to the head, an immediate and appropriate response is vital. Head injuries should be treated like any other incident that requires a first aid response. The 3 first aid priorities in dealing with the casualty are commonly referred to as the ABC of first aid. A. Airway. B. Breathing. C. Circulation. Remember, do not attempt to move the child, other than required for airway support, unless trained to do so. Do not remove protective headgear, for example helmet, if present, unless you are trained to do so. Do seek medical advice/assistance. Early years provision will operate in compliance with the EYFS statutory requirements, with some surpassing minimum standards with all staff first aid trained. If you have not done so, familiarize yourself with basic first aid as a minimum and consider enrolling in a pediatric first aid course. Babies and young children are not able to express how they feel. Therefore, if you suspect they have received a significant blow to the head, or if they display any of the symptoms previously discussed in this module, call 111 or visit your local accident and emergency service. You should always seek immediate medical help if a child in your care receives a knock to the head and displays the following symptoms: vomiting, loss of consciousness, difficult to wake, has a seizure or fit. Because concussion can be harder to spot in babies and young children, important symptoms to look out for are changes in their normal behavior after a head injury, such as crying a lot, differences in their feeding or sleeping habits, a loss of interest in people or objects. If symptoms are more severe, such as where the child is unconscious or if they appear to be having a seizure or a fit, you should call an ambulance. When responding to a child who may have suffered a concussion, it's important to remember the 4 rules of concussion response. 1. Remove from activity or play. If they haven't passed out and seem well enough to move, remove them from play or the physical activity and have them sit down to rest. Note: feeling better quickly after a concussion is common, but it is not a sign of recovery. The injured person should not return to play. 2. Talk to them. If they are old enough to converse with you, use this as an opportunity to ask some questions about how they are feeling. How they answer helps to determine if they have had a concussion. For example, slurring words or being confused is a good indicator that they have suffered a concussion. 3. Medical advice. Even if there is the slightest chance that a child or young person has suffered a concussion, it is good practice to have them assessed by a doctor or medical professional or contact NHS online on 111 UK for advice on next actions. 4. Rest. Where a child or young person has suffered a concussion, it is vital they rest both mentally and physically.